The broadcast is now starting. All attendees are in listen-only mode.
Okay, hi everyone. My name is Dr. Tanya Manikkam, and I'm going to be giving the webinar tonight on thyroid optimization. We are waiting for a few more people, so we're going to give them a chance to log in. So while we're waiting, I'm just going to give you guys a little bit of information. So there should be a section called handouts in your GoToWebinar menu. There's 3 handouts there, and one of them is actually a PDF of the slides. So if you want to print the slides to go with the presentation, then you can absolutely do so, or you can always download it for the future if you want to go back to it. Another thing is about questions. So everyone's going to be able to ask me any questions they want. I will answer them though at the end of the webinar. So feel free to type them up. There's a questions section again in your menu. Just type them there and then I will answer them out loud at the end. So they're going to be anonymous. Nobody's going to know your name. So feel free to ask anything that you want. So let's see at the time. So I think we're past 7 o'clock, so we're going to get started. So today we're talking about the thyroid, and I'm extremely excited about this webinar just because it's a passion of mine. For those of you who don't know me, my name is Tanya Manikkam. I did my undergraduate degree in psychology. I studied naturopathic medicine in Toronto at the Canadian College of Naturopathic Medicine, and I graduated in 2009. I practiced by myself a bit, and then I joined NutriChem in 2013. My special interest for my practice is mental health as well as hormones. I'm a member of A4M, which is an American company, so the American Association of Anti-Aging Medicine, and they're huge in hormones. And through them, I'm doing a certification in advanced endocrinology. So let's move on. For those of you who don't know what a naturopathic doctor is, we are licensed practitioners. It goes by province though. We have a similar education to a family doctor, but we tend to use nutrition, supplements, herbs. Some of us will use acupuncture to treat. The goal for us is really to find the root cause. So if you're not feeling well, I want to know why. I don't want to just throw things at you. We are covered by most extended health benefit plans, and we have prescription rights in 2 provinces. So in BC and Ontario. So if you're seeing a naturopathic doctor in either of those provinces, they can prescribe thyroid hormone for you. In Ontario, we can only prescribe desiccated thyroid, but I believe in BC, they can actually prescribe both Synthroid or levothyroxine and desiccated thyroid. So the thyroid gland, it's a gland in our neck, and it's extremely important. And what I've come to realize is what we know about the thyroid is that there's lots we don't know. So many of my patients come in, they're feeling lousy, they're tired, they have weight issues, they have dry skin, they're losing their hair, and they come in, they're like, yeah, I really thought it was my thyroid, but my doctor tells me it's normal. So unfortunately, in the medical world, we still have so much to learn about the thyroid gland. What we do know is that everything starts at the brain. So the hypothalamus, so a section of your brain, is actually going to tell your pituitary gland, a different section of your brain, to tell your thyroid gland to work. It all starts pretty up there in the brain. We do know that the thyroid gland secretes different types of hormones. So hormones are little messengers. And we do know that some of those hormones are T4. We know that it secretes T3, and it also makes T3 out of T4. We know that there's actually T1 and T2 as well. So other thyroid hormones, we don't really know their functions. We're not really good at measuring them, so the tests for them are not that fantastic yet, so that they're really not used clinically. We also know there's calcitonin, so another hormone that's secreted by the thyroid, and this one helps regulate calcium in our blood. So T4 and T3 are the ones we're going to focus on today for sure. So T4 is known as the inactive thyroid hormone. You take T4 and you turn it into T3, which is the active thyroid hormone. And really the difference between the two is if you look at the pictures here, T4 is at the top and T3 is at the bottom. T4 has 4 pink balls and T3 has 3 pink balls. So those pink balls are actually iodine. So you need iodine to make thyroid hormone. And you start off with T4, and then your body, an enzyme in your body actually takes away 1 at those pink balls, and that activates the thyroid hormone and it becomes T3. So it's very simple, the difference between the two, structurally anyways. It's estimated that 200 million people worldwide have some sort of thyroid disease. And recent studies show that maybe 1 in 10 Canadians suffer from a thyroid condition. And this is according to the Thyroid Foundation of Canada in 2017. So it's fairly accurate, or I should say recent information. Now, before we go in depth about hypothyroidism, it's really important that we talk about hyperthyroidism. So hyperthyroidism is a condition when the thyroid is overactive, right? So it's secreting more hormones than it should. Symptoms include nervousness, can be anxiety, rapid heartbeat, can be hand tremors, people have diarrhea, sweating. They'll have a lot of energy, but it's an uncomfortable energy, so they'll be jittery. The reason it's really important for you guys to understand hyperthyroidism is because for those of you that suffer from hypothyroidism, with everything you're going to do to help yourself, you want to make sure you don't push your thyroid in the hyper state. So get to know those symptoms so that you can watch out for them as you're yourself treating yourself or working with somebody to treat yourself. Now, as far as hypothyroidism, what I've noticed, so this is a personal opinion, it's my personal observation, there's no research around this, is that often though, the signs and the symptoms usually start way before the lab results start showing signs of hypothyroidism. Meaning a person will be tired, they'll start having a hard time losing weight, they'll say, oh, you know what, I'm starting to lose my hair, but the labs will be normal. But then down the line, a year or two later, oh, there are the signs that the labs are off. So we really have to also listen to, if you're a clinician, listen to your patients, or make sure that if you are the patient, to make sure that you're heard, that your symptoms, they're not in your head. And so make sure you're aware of them, and the person that you're working with to treat you is aware of those symptoms too. So signs and symptoms of hypothyroidism. Fatigue is usually the biggest complaint. People are tired. They might have thinning hair, thinning eyebrows. They'll feel cold. They'll be sensitive to cold, but they'll actually be sensitive to heat as well. So they'll feel cold, but as soon as they're into heat, they can't handle it. They might have dry skin. Cracked heels is a big one. Brain fog, so they'll have focus issues, joint aches, and that's something that people don't realize, I think. So often when we optimize the thyroid for our patients, the first thing they come back and tell me, they're like, I just noticed that my pain is gone, or my pain is significantly less, and they had no idea that the pain they were experiencing was actually related to the thyroid. A lot of people will gain weight, or they'll have a hard time losing weight. They might have constipation. Brittle nails. So that's another thing. When someone starts optimizing their thyroid, I get a lot of women come back, and I think once a week somebody comes in and because women often get their nails done, and they'll tell me, oh, I went and got my nails done, and the person told me that they were surprised at how healthy they were. And again, that's the thyroid. People with hypothyroidism might have menstrual irregularities, so they might have heavy periods, that kind of stuff. They might have fertility issues, hard time keeping a pregnancy, as well as getting pregnant. They might suffer from depression. They might be sad. There's something called the puffy face, which is the hypothyroidism face. I know that certain big physicians in the States that deal with thyroid a lot, they'll often post pictures of their patients before and after, and they always talk about that puffy face. Morning stiffness, so they wake up in the morning and might be stiff, but as the day goes, then they loosen up. Menorrhagia just means a heavy period. They might have anxiety, muscle cramps. Carpal tunnel syndrome is more common in people with thyroid issues. Fibrocystic breast, so lumps in the breast. Low stomach acid is something that's big for hypothyroidism, and we'll talk a bit more about that later because that can lead to other issues like low vitamin statuses, low minerals. They might have increased inflammation. So with my patients, I always test something called HSCRP, and that tends to be higher in people with hypothyroidism. It's a sign of inflammation. It's a very sensitive test for inflammation, and I really encourage everybody to ask their doctors for it, or if not, see a naturopathic doctor and just get it done, pay for it and get it done. It's a good marker too for cardiovascular inflammation. So it could, tell you if you're at risk of heart disease in the future or if it's something you need to work on. People complain that their hearts, they're skipping a beat, or they're known to have slow heartbeats as well. So lots of signs of hypothyroidism. And the truth is that hypothyroidism rates are actually increasing. And why is that? We're not sure. There's one little theory that's, well, the patients now are surviving longer because we do have thyroid hormone. Therefore, they're passing along the genes. Could be environmental toxicity. So we now know that bromide, cadmium, toxicities with those can actually cause our hypothyroidism. And maybe there's just a history of being underdiagnosed, right? So it's people are talking more, especially with social media, um, books like The Thyroid Madness, The Thyroid Solutions, all these avenues of basically marketing hypothyroidism in our communities. So it's really bringing awareness to it. So what causes hypothyroidism, though, biochemically, physically? Primary, there's different types. So primary is when it's an actual thyroid is just not working. The secondary is when the pituitary gland is just not working properly. So the middle guy. And then tertiary is when the top guy or the top woman is not working properly. So that's the hypothalamus failure. Now, some people, it doesn't even have to do anything with those. It's actually that they just can't convert their inactive thyroid hormone into the active thyroid hormone. So they have a really hard time converting T4 to T3. So you do their test, TSH is normal, T4 is normal, and then you test for T3 and oh geez, it's so low. Some people have something called thyroid resistance, and that's actually, I find, really, really hard to treat. So basically, you know how people have insulin resistance, meaning, so insulin is a hormone in your body, and it's meant to take sugar from your blood and put it in your cells. So with thyroid resistance, people are just not acting to the thyroid. So the thyroid hormone is there, but their body is just not being able to react to it. And now some people, the thyroid issue, so hypothyroidism is all because of adrenal dysfunction. So their adrenal glands are off, which is what causes the hypothyroidism. So if you have hypothyroidism and your adrenals have never been checked, make sure you go get them checked. And we'll talk a bit more about the testing that we should do. So let's talk about the test first, right? So if you suspect you have hypothyroidism, you're going to want to do some testing. And these are the tests usually that I recommend my patients to do. So TSH, almost every practitioner or medical doctor will do a TSH. Until a few years ago, TSH was considered a gold standard for diagnosing anybody with a thyroid disease. For many practitioners, it still is. In the literature, it still says it should be. But all these doctors now, especially integrative doctors and people kind of looking a bit more, into research and stuff, we're realizing that, you know what, people's TSH, we're bringing them to normal and they still don't feel good. And we have to listen to that. So by doing so, we test free T3 and free T4, which we'll talk in a minute about. TSH is measured in the blood, so it's an easy blood draw. TSH is a hormone, right, released from our brain to tell our thyroid to work. So the more the brain releases of this hormone, the less your thyroid works. So it's your brain saying, come on, I want you to work, I want you to work. So the higher your TSH is, the less your thyroid works. Now we're in Ontario, or I'm in Ontario. Normal values for Ontario are 0.35 to 5. Some labs now say it's 0.35 to 4.2, which I think is great because we're going in the right direction. There's another lab that says it's 0.35 to 5.2. If you go to different parts of the world, though, there's a lot of places where actually normal for them is 0.35 to 3. And there's somebody, Dr. Hollowell and his colleagues, they actually decide, you know what, let's redo this. They took a bunch of people in the United States and they just took their TSH just to see, okay, what's the average? And they found that the average TSH for a person should be between 1.4 to 1.5. So even 3 is kind of pretty high for if you compare it to the average person. So my patients, to start with, when I look at their TSH, right away I want it to be below 3. If it's over 3 for me, I tell them they have something called subclinical hypothyroidism, meaning according to the labs in Ontario, you don't have hypothyroidism. But if you have the symptoms and your TSH is over 3, we just call it subclinical. So what we do realize is that TSH might not be the most sensitive test. Optimal TSH levels keep getting lower and lower, right? At one point, TSH levels were considered abnormal if they were over 10. Then they went to 8, 6, now it's 5, and Like now I'm saying it's 3. And eventually, even with 3, I prefer it when they're floating around 1.0, at least below 2. So that's why it's important. You have to take into account the clinical picture, and we have to listen to our patients. And if you are a patient, you need to make sure that you're heard and see a clinician that will listen to you. So free T4 and free T3, I always measure both along with TSH. There's no question about it for me. So free T4 and free T3, they're not often tested if you're going to see a regular practitioner. It's not part of standard of care. In fact, the literature will actually say you're not supposed to measure free T3. So right now, free T3 is not even supported as a measure for hypothyroidism. Free T4 is considered okay to measure if somebody is taking T4 or if somebody suffers from hyperthyroidism. But what I think is important is that when you're measuring free T4 and free T3 is that you're actually testing the hormones that are coming out of your thyroid. So that makes a bit more sense. So you're not just testing the hormone your brain is telling your thyroid to work. You're measuring the hormones coming out of your thyroid. I mean, if we want to check if somebody has low testosterone, what do? We test their testosterone levels, right? If we want to know if they have low progesterone, we test their progesterone. So why are we not testing the thyroid hormone, the actual thyroid hormone? Your body has to convert T4 into T3. So T3 is the activated thyroid hormone is what we call it. So for my patients, so again, in Ontario, what's considered normal, and if any of you have your blood work in front of you, go get it. Or if you have it in the house, go get it so you can make sure that you're in the optimal ranges. But free T4, usually people feel better when this number is above 14. And free T3, people usually feel better when this number is above 4. To be honest, people feel great when it's around 5, but at least above 4. So if your free T3 is below 4, for me, that tells me, even if your TSH is normal, that tells me that, you know what, your thyroid is still not optimal. So T4 to T3 conversion, I had a little drawing hand, it doesn't seem to be showing up. So for T4 to be converted to T3, like I said, you have to take away a iodine. So it's very simple. There's an enzyme. So there's actually more than one enzymes. They're called D1, D2, D3, D4. You need selenium, which is very important. And you have to make sure that you have enough iodine to make thyroid hormone to start with. Now, if your T4 does not turn into T3, what might happen, you might be making something called reverse T3. So instead of turning T4 into T3, especially if you have lack selenium, you're going to make reverse T3, and reverse T3 counteracts the positive effects of T3, which means, so let's say we're going back to the lab work. You have normal TSH, you have normal free T4, you have normal free T3, but your reverse T3 is high. That's going to counteract the effects of your T3, and you're going to have to work on that. In Ontario, normal values 9.2 to 24.1. So what is considered high for reverse T3? It's really kind of subjective right now because this is where we need a lot of research. We really need somebody to just go and measure so many people's reverse T3 to find out, okay, what's the average? But we usually know that if it's above 20, it's considered high. With my patient, I definitely want them to be below 19, below 17, and then I think, okay, we're probably okay. If high, you will probably feel better with desiccated thyroid or combination therapy. So what happens is T4 turns into reverse T3, right? So if you're taking Synthroid, levothyroxine, so if you're taking T4 as a medication and you're turning into reverse T3, then it's not working out for you, which means you're a better candidate to take actual T3 because you don't turn T3 into reverse T3. That's not how it works. It's T4 into reverse T3. So we have T4, T3, reverse T3 right here. So if you look at what the difference is, like I said, T4 has 4 balls, 4 iodines. T3 has 3. And if you look at the missing iodine, so the missing green ball, it's on the outer ring. And then reverse T3 is when it's the inner ring that's missing a ball. So that's the difference between all 3 hormones. And let me see here. So some people seem to not be able to hear on the webinar. So I'm just going to pause for a second because we have people saying they're hearing and people are not. So we just want to make sure it's not something on our end. Okay, so most people are saying they can hear us. So hopefully, if anybody had any issues with not being able to hear, we're actually sending the recording to everyone anyway, so everything's going to be okay. All right, so what are symptoms of high reverse T3? They're basically symptoms of hypothyroidism. Fatigue, people will be tired, people have a hard time losing weight, brain fog, joint pain, and sore muscles. So if you're treating your thyroid and all your labs are normal, but you still feel signs of hypothyroidism, go get your reverse T3 checked. You can get this done through your medical doctor. Unfortunately, not all medical doctors will do it, so you might have to see a naturopathic doctor. What can affect the conversion of T4 to T3? A selenium deficiency can. Zinc deficiency can as well, because zinc is important to turn T4 to T3. Stress. When cortisol is high, it stops the conversion of T4 to T3. So people, we need to make sure we're relaxing. I ask this, anybody who's ever seen me as a patient, they always know I always inquire about stress levels, and I always ask them, what do you do to relax? Do yoga, meditation, read a book, take a bath with candles. People will often tell me, oh, I go for a run to relax, but I know it feels good, but it's not relaxing. That's not bringing your cortisol levels down if they're high. Inflammation can affect the conversion of T4 to T3. Get your inflammation tested. Test HSCRP. See, is your inflammation high? If so, you're going to want to do something about that. A high carbohydrate diet, high insulin levels. Certain drugs can as well. So if you're taking a beta blocker, it might have an issue. It might affect that as well. And dieting, especially people that do yo-yo dieting, that can really impact your conversion of T4 to T3. Okay, so we tested TSH, we tested free T3 and free T4, so the hormones coming out of your thyroid. We tested reverse T3, and now you're going to want to find out, is your thyroid issue an autoimmune issue? Is your immune system attacking your thyroid, and is that the reason you have hypothyroidism? So there's different antibodies. So antibodies are basically your immune system soldiers, right? So if it makes soldiers against your thyroid, then that's not good. We don't want that. So you can get those tested. It's very simple. So the main ones are thyroglobulin antibodies and thyroid peroxidase antibodies, also known as anti-TPO. If these are high, you have Hashimoto's, and Hashimoto's is an autoimmune disease of the thyroid, meaning the immune system attacks the thyroid. And I'm going to talk a bit about Hashimoto's, because if you do have Hashimoto's, you're going to want to do a couple other different things, especially diet-wise, and we're going to talk about that as well. Now, some people, their immune system actually attacks the receptors. So a receptor is what a hormone attaches to deliver the message. So some people, their immune system actually attack the receptors on the thyroid gland, and that's why they have hypothyroidism. So super important to test your thyroid antibodies. Again, all medical doctors can do this, no problem. But if they don't want to, you might just have to go see a naturopathic doctor, an integrative doctor, and just pay for it, really. Now, other thyroid hormone testing, these are not done as common. Thyroid binding globulin. So basically what happens is we test free T3 and free T4. We want to know the hormones that are free for you to use, basically. But some of your hormones are stored. And thyroid binding globulin stores thyroid hormone. It carries it through the blood, but this is not, the hormone attached to it is not available yet. If somebody has a high TBG, that means that most of the thyroid hormone is stored, so it's not usable. This you'll see a lot in women that have high estrogen levels. So if you've tested your other hormones and you know you have high estrogen and you also have hypothyroidism, the estrogen might be the root cause of why you have a thyroid issue. So go ahead and get that tested as well. Then we have thyrotropin releasing hormone. So basically we want to know, okay, is it your hypothalamus that's causing the hypothyroidism? So does it come way up from, the big woman, the big guy up there is what we want to know. These two tests I don't normally do. They're not routine for me. All the other ones I mentioned were routine for me. This would be kind of like, okay, nothing's working. We need to look into this a bit more. Now, one thing I do with my patients, most of my patients, I don't do it right off the bat, but I would always recommend it eventually, especially if we're not getting the results we want, is to test iodine, selenium, bromide, and cadmium. So this is a urine test. It's not covered by OHIP, so this is something you would have to pay for. We want to know, okay, do you have an iodine and selenium deficiency, or do you have a bromide and cadmium toxicity? So iodine deficiency is on the rise for two reasons. We were just not intaking it as much, and we also have an increased intake of bromide, which takes basically the spot of iodine on molecules. Cadmium interferes with the function of selenium, and if we remember correctly, selenium helps convert T4 into the active T3. So if your selenium can't function, you're going to have a hard time with conversion. So like I said, this is done via urine. Some people, for the iodine, they'll do a challenge. So basically, they'll take iodine before doing the test, and then they'll collect their urine for 24 hours, and then the lab will see how much iodine is in your urine. If it's very little, it means that you're iron deficient because your body took up all the iodine. But if there's lots in your urine, that means you're not iodine deficient. This is an example of the test results for the iodine urinary testing. So what they do is they compare to the World Health Organization, so basically the levels worldwide. And it's just on a graph like this. So this person has more than enough iodine. So basically, I would tell this person you don't need to supplement with iodine. But if we look down at their cadmium, it's fairly high, right? So cadmium, this would mean that their selenium is probably not acting like it should. It probably is not functioning as well as it should. So we'd want to get rid of the cadmium for that. This test, I believe, it's not overly expensive compared to other integrative testing that you can get. It's under $200, so I always highly recommend it, especially if you want to take iodine, especially in higher doses, then you're probably going to want to get tested first. Now, other tests that I usually will consider doing is the adrenal function, and we'll discuss that further. I might test zinc, iron, and B12. And the reason for the iron and B12, I will test it because, like I mentioned before, people with hypothyroidism often have low stomach acid, which means they can't absorb their iron and their B12s properly. So then they end up with low ferritin and low B12. Vitamin D is important for all hormones, so we're going to want to make sure that you have enough vitamin D. If you do get your vitamin D tested, for me, so sufficient is over 75, but I always want the numbers to be above 120. So just a little side note if you do have your test results with you. I'll often test other hormones. Like I said, estrogen, high estrogen can affect the thyroid, so I'll test often estradiol, progesterone. We'll often test testosterone, insulin. So all the hormones, they all talk together. They're all, buddies, or they're supposed to be. So it's good to sometimes just take an overall look at all your hormones, not just focus on the thyroid. If you want to know if you have low stomach acid, you can do something called the HCl challenge. It's basically, so if you have undigested food in your stools, if you suffer from bloating, gas, then you might have low stomach acid. So what the HCl challenge does is you basically get betaine HCl and you take one capsule with your next regular meal. If you don't get heartburn, the following meal, you take 2 capsules. And then the following meal, 3. And you keep going until you get heartburn. Or usually I tell my patients, okay, once you've reached 6 to 8 capsules, it's fair to say you have low stomach acid. So that's just a little at-home test you can do to find out if you have low stomach acid. The only time you don't want to do that test is if you have an ulcer, though, because you don't want to put that acid in there and make it bleed. So let's talk about allopathic treatments for thyroid. So thyroid medications, that's levothyroxine, so that's Synthroid. Liothyronine, which is Cytomel, so that's T3, so you can take T4, you can take T3. There's desiccated thyroid, which is animal thyroid tissue, that contains T4 and T3. And then there's compounded synthetic T4 and T3. So basically, if you can't take a certain dose that the Synthroid comes in, well, a compounding pharmacy could put it in a capsule with a different dose and add T3 to it. So basically do the ratio that you want. Synthroid is the most commonly prescribed medication for the thyroid. It's T4. It's oral use. It's by prescription only. You can actually get levothyroxine. You can actually do it in a cream too. I actually just did that with one of our patients, so we'll see how that turns out, especially if somebody has a really hard time digesting it. It is synthetic thyroid hormone, but it does mimic the hormone in our body, so you're able to measure it in the blood. Dosages vary, can go from 25 micrograms to 300 micrograms, and usually your doctor will start you low and then increase the dose accordingly. Now, what's really interesting is that if you look at the monographs for Synthroid, it'll actually say it's contraindicated in patients with uncorrected adrenal insufficiency. Now, their definition of adrenal insufficiency means they're not producing, adrenal hormones at all, right? But it's just, even with that said, I mean, I don't know many doctors that actually test cortisol levels in their patients. So the adrenal hormones, So if you're not supposed to give this medication if somebody's adrenals aren't normal, how do you know if you're not going to test it? So I just thought that was very interesting. Side effects from Synthroid, it's usually signs of hyperthyroidism, to be honest, if you're taking too much. But some people will feel more fatigue. They'll have an increase in appetite. They might have weight loss, excessive sweating. Some people get headaches. They get nervous. They might have insomnia. A lot of the complaint I hear the most for Synthroid is probably fatigue and diarrhea, actually, which is not there. They might have muscle weakness, muscle spasms. They might start getting heart palpitations. That would be mainly, I think, if the thyroid was, it brought them in a hyperthyroid state, though. Tachycardia, arrhythmias. Can cause heart failure, angina, a heart attack, myocardial infarction, cardiac arrest. Again, that's usually for overdose. So another commercial drug that's available is called Cytomel. So that's actually T3. And to be honest, not a lot of doctors know about it. So when I have a patient that just, doesn't agree with desiccated thyroid, which is what I can prescribe, I'll often go back to their doctor. If we can't bring that T3 up, I'll go back to the doctor and I'll suggest, hey, why don't we add Cytomel to the mix? And it's very underknown. So it's just, I just don't know if it wasn't marketed right or what's the deal. But a lot of doctors actually don't know about it and don't know how to dose it. So if you're somebody your TSH is normal, your free T4 is normal, you're taking desiccated thyroid, and your T3 is not going up, what you might want to do is add T3 itself. And usually I start my patients with the 5 first. So you start with 5, and then you retest in 4 weeks, and then you go to 10, you retest in 4 weeks, and then you go like that. Again, this one's contraindicated too for anybody who has adrenal insufficiency. So everybody should be testing the adrenal glands before giving any type of thyroid hormone. Adverse reaction to T3 is, again, very similar to T4. So if it's the thyroid's overworking, so signs of hyperthyroidism, excessive sweating, fatigue is there again though, increased appetite, increased pulse, people can get headaches, irritability, they can get a decrease in bone mineral density, there's the diarrhea, so there's very similar side effects. Now, some people do well, like I said, in combination therapy, which means that they go to a compounding pharmacy and the compounding pharmacy puts T4 and T3 at whatever ratio is needed in a certain capsule. It can be very useful, I think. I think it's great. So, especially because desiccated thyroid just comes basically in different specified doses, right? But you can't control the amount of T3 and T4. It's really set. So if you want a certain amount of T3 as opposed to T4, it's a good way to go. This is a little study, and what they did is they basically made people take a combination of T4 and T3. So instead of just giving T4 alone, they made them do T4 and T3. And they noticed that the people actually lost more weight and generally felt better. And this is another study. And again, they took people that were already on T4 and they substitute a part of it for T3. So the people are taking combination of T4 and T3. And they came to the conclusion that T4 with T3 may improve mood, neuropsychological function. So anybody who suffers from depression, anxiety, that kind of stuff, maybe a combination would be a better choice for them. Now, desiccated thyroid, so naturopathic doctors in Ontario can prescribe desiccated thyroid. It's sourced from porcine, so it's a pig thyroid gland. In the United States, they have different desiccated thyroids. So they have porcine as well mainly, but they also have cow. So they have a bovine available as well. But in Canada, only porcine is available. We call it for short NDT, and it's available in most pharmacies by prescription. So you can get a prescription through a medical doctor, a naturopathic doctor. So people often ask me, they'll come to see me because they want desiccated thyroid. And I ask, well, did you ask your doctor? And they say, no, they didn't know their doctor could prescribe that. Well, the answer is yes, it is a prescription. In the United States, the main desiccated thyroid is Armour and Nature. In Canada, it's IRFA. And the IRFA tablets come in 30, 60, or 125 micrograms. But if somebody needs 45 milligrams, 75 milligrams, we can adjust the dose. So the compounding pharmacy can actually make a whatever dose you need, really, or we'll tell people take 1.5 tablets. Now, is it safe? Because there's a lot of arguments against desiccated thyroid, especially when patients go back to their doctors and say, oh, I'm taking desiccated thyroid now. The main argument is against the standardization of dose, meaning that a tablet could have different amount of hormones from one to the next. IRFA, like I mentioned, is the only manufacturer in Canada, and their desiccated thyroid is standardized to contain a specific amount of T4 and T3. And I think T4 is about 18 micrograms and T3 around 5 micrograms, give or take. So it is standardized, and it has a DIN number, so a drug identification number. So it is reviewed and approved by Health Canada as well. So the safety behind desiccated thyroid, Health Canada would not approve this as a prescription drug if they hadn't looked into it. The adverse effects for desiccated thyroid are very similar again to hyperthyroidism. So nervousness, tremors, headaches, insomnia, heart palpitations, diarrhea, abdominal cramps, sweating, heat intolerance. So again, for me, the most common complaint would probably be abdominal discomfort. So if that's the case, then we can make the desiccated thyroid into a liquid, and people seem to tolerate that better. But it's really rare. I've only had to do that twice. This is a little study again. So desiccated thyroid extract for the treatment of hypothyroidism. And I believe what they did here, so yeah, it was a randomized double-blind crossover study. Basically what they did is they gave T4 for a moment of time, and then they gave desiccated thyroid. And the people actually said they felt better on desiccated thyroid, even if the TSH they were brought to the same levels. But people just generally said, hey, I felt better when I took this, and it ended up being the desiccated thyroid. And people tend to lose more weight on desiccated thyroid as opposed to taking T4 alone. The big question I get often, can you use desiccated thyroid for patients with Hashimoto's disease? So Hashimoto's, just a reminder, that's when the immune system attacks the thyroid, right? So the thought is, well, if you're taking thyroid gland tissue, is it going to make the immune system overreact even more? Patients with Hashimoto's taking T4 only were switched to desiccated thyroid versus a control group who had stayed on T4. And they actually noticed an improvement in cellular immunity and no change in humoral immunity. So the answer is, I'll tell you guys from my experience, is that I have a lot of Hashimoto's patients. And like I said, I can only prescribe desiccated thyroid. So that's all they're getting from me. And I'd say two cases where we actually noticed that the antibodies did increase, but the patient was feeling better. So it's like, okay, do we listen to the numbers or do we listen to, your clinical signs? You're feeling better, you have more energy. So I know that I've read somewhere that sometimes if TSH with desiccated thyroid, the antibodies will rise initially, but then they go back down. So I'm not sure about that. I have to look into that a bit more. But, listen to the patient and listen to yourself and make sure you're heard. If you're feeling better, you're feeling better. Another thing is that a lot of people will say another controversy is T3, that T3 can cause cardiovascular disease. And to be honest, it's actually the opposite. So these are all researches on specifically T3 and cardiovascular health. We saw that it lowers CRP, and like I mentioned before, CRP is inflammation, so it increases heart disease. There's something called homocysteine, that if this is high, people are at risk of heart disease. T3, when it's at the right level, actually lowers homocysteine levels. It helps dilate the arteries. So these are all studies that kind of support that, T3 is actually important for heart health. Arguments against T3 that I hear often too is that it has a short half-life, and that is true. So when you take T3, initially your body does get a boost of T3 and it does taper off. When you start getting at bigger doses of T3 or desiccated thyroid, often I'll tell the patient, take one in the morning and one at lunch, to spread it out so you get the full benefits for a bit longer. Another argument is that the desiccated thyroid has 20%, it's made up of 20% T3 as opposed to humans only have 10% of our hormone T3. I mean, we're testing people's free T3 and free T4, so we know, we have an idea of what the levels are, so I don't see why that would be an issue. Another myth or another argument that people will say or doctors will challenge us on is the dangers of a low TSH. Because our medical system, we're told you got to look at TSH, right? And sometimes, to be honest, we're bringing the TSH pretty low because people's T3 are just not high and they don't feel good. They still feel hypothyroid. So the two arguments is that if you have a low TSH, it can lead to osteoporosis and it can increase heart issues, so cardiovascular irregularities. Now for the osteoporosis, they are doing studies on that. So they're looking. And so far, the studies have claimed that, no, this is a false statement. For postmenopausal women, though, it's been shown that they might have an increased risk of osteoporosis. Again, for postmenopausal women, they also don't have the estrogen, the estradiol, the estriol that help them with the bones, right? So I'm not sure if it's more the thyroid as opposed to the other hormones being an issue. But if you really want to find out, there's something called terminal telopeptides, and it's a urine test. And you will see if this test becomes positive, then it will tell you, what, you are getting bone loss. But if it's negative, it's going to mean, no, you having a low TSH that is not affecting you. It's available through the States only. So it's not something, I don't believe anyways, that it's available in Ontario. You kind of have to order it through the States. And then for cardiovascular health, if that is a concern of yours, if it's a concern from your practitioner, then go get an ECG. Find out, okay, how does it look? How are my heartbeat? How's my heart rhythm? And if everything's okay, well, then you're good. Usually a patient will know if it's affecting their heart though, because they'll be like, okay, I'm having heart palpitation. I have to cut back. So, thyroid can be used for a lot of stuff. So here's a favorable risk-benefit analysis. So this study, they were giving high thyroid to people with bipolar disorder. So they were actually bringing their TSH very low, so below 0.01. So they wanted to see, okay, are these patients at risk of having osteoporosis? And the answer was there was not an increased risk for these people. So we talked about the thyroid medications and the thyroid hormones. So let's talk about the integrative treatment, so also known as alternative treatments. So iodine. What we know about iodine is that it's needed to produce thyroid hormone. So if you're low in iodine, you won't be able to make thyroid hormone. Recommended daily intake is approximately 150 micrograms per day, but a lot of people argue that this is too low. So a big practitioner in the States, Dr. David Brownstein, so he's huge on iodine. Most of these notes are actually from some of his lectures. He states that if your patient needs, or if you yourself needs a TSH to be below 0.01 to feel good, that you're most likely iodine deficient, or they're most likely iodine deficient. For me, I agree with the statement a little bit. I always tell my patients, okay, so finally you're feeling good, your T3 levels are good, but we are bringing your TSH down to 0.01. So I tell them we're missing a piece of the puzzle. This is when, if they haven't done the iodine testing, I tell them, let's do the iodine testing. Let's see what happens. But it could be their adrenal glands as well. So I also say, let's go. We really have to keep an eye and look more deeply into your adrenals. Is it dangerous? No, but we're missing a piece of the puzzle, and we don't want to miss a piece of the puzzle. When you're taking iodine, so let's say you do the urinary iodine testing, you're low in iodine. When you will take the iodine, it's normal to see a rise in TSH. It can last from 3 weeks to 3 months. We go by how you feel though. If you're feeling good, then it doesn't matter this number. If somebody feels bad though taking iodine, they're most likely high in something called bromide. If they did the test, they would know. If they haven't done this test, then my guess would be, oh, you know what, you're high in bromide. We need to get rid of the bromide first, and then you'll be able to handle the iodine. Bromide, chloride, and fluoride competes with iodine, so something to keep in mind. Recommend to test before supplementing with high dose. So that's my thing. I'm all about testing and then giving according to test. And food-wise, sea vegetables are a good source of iodine. So if you like seaweed, then you're probably good. Conditions improved overall by iodine, or low iodine can lead to fibrocystic breasts, hemorrhoids, fatigue, headaches, migraines, ovarian cysts, and cold sensitivity as well. You're going to want to look at selenium. So you can actually test selenium as well. We tested in the urine with the iodine. It's just eased that way. Selenium helps T4 convert into T3, right? In Hashimoto's disease, though, they've done a lot of studies for selenium, especially selenomethionine, so that type of selenium, in Hashimoto's disease, and without even testing the people before. And by giving 200, most of the tests are 200 to 400 micrograms. They notice it reduces inflammations, so their inflammation markers go down and their antibodies go down and up to 40%. So if you have Hashimoto's disease, you're probably going to want to think about incorporating selenium in your protocol. Brazil nuts are actually really high in selenium. So they're so high that if you want to eat Brazil nuts instead of taking a supplement, they're just as good. And you only need 2 to 4 per day. So usually we'll tell our patients take 3. That should be above 200 micrograms of selenium. And then if you have hypothyroidism and you are having the digestive issues, like I said, you can do the HCl challenge to see about your stomach acid if it's too low. Because if it's too low, then you'll have undigested food, gas, bloating. You'll probably be low in B12, low in ferritin, low so iron. So you can actually supplement with HCl with your meals, and you'll notice that you start building your acid back too. So as your thyroid gets better, as you're taking HCl, your stomach's like, oh, you want me to make more acid? Okay. And then eventually it kind of catches up. And you can take digestive enzymes as well to help digest your food in the meantime, especially if you have undigested food. So if you see pieces of lettuce, pieces of carrots and stuff in your stools, they shouldn't be there. It means you're not digesting your food properly. Low-dose naltrexone, so I don't have prescribing rights for low-dose naltrexone, but if you see an integrative medical doctor, they do. So it's being studied now for a lot for autoimmune diseases in general. And some people, so there's no big study, not that I could find anyways, but you'll see cases here and there of people with Hashimoto's being prescribed low-dose naltrexone, about 3 to 5 milligrams. And it actually does them very well. And we're doing this for lupus, like a lot of these autoimmune diseases. At very low dose, it increases endorphins. It's been done in Crohn's disease. So there's something, especially if you're somebody with Hashimoto's that, you just can't get balance. It would be maybe something to try. And then when it comes to nutrition, so the brassica family is something that's always talked with the thyroid. And I get asked this all the time. Can I eat broccoli? Can I eat cauliflower? So what happened is in the 1920s, there was these scientists and they noticed that they gave cabbage, but they gave a lot of cabbage, okay, to rabbits. And they noticed they all developed goiters. So basically their thyroid got big. So they got thyroid issues. Since then, so people are trying to replicate these studies and they're always done on animals though, okay? And it seems, and they're giving so much raw like cabbage and they do kale and, it's such big doses that, I don't think I'd ever be able to eat myself. So it's really, really high doses. And yes, it's been shown, okay, you know what? It is affecting the thyroid a little bit. But when they did research on humans, to be honest, they didn't have the same results. So we're kind of up in the air for the brassica family. I think if you're eating them, and we know that if you cook them, you kind of get rid of the chemicals in them that are goiterogenic, meaning that they cause the thyroid to enlarge. So if you're going to eat those, I tell my patients, you know what, we're still unsure right now. So if you're going to eat any vegetables in brassica family, just make sure that they're cooked. If you're going to eat, like 3 pieces of broccoli that's raw because you're at this, picnic or something, I'm sure you'll be fine. Just don't go eating a huge bowl of it right now. And even then, I'm not even 100% sure because the research, we're kind of 50-50 on it. Gluten. So what we do know is that there's a higher incidence of thyroid issues in individuals with celiac disease. And that's tested and researched over and over again. So if you suffer from an autoimmune disease, autoimmune hypothyroidism, so if you have Hashimoto's disease, I highly recommend you either cut gluten out of your diet completely and strictly, or you go get tested for celiac disease because it could definitely be a possibility. People always talk about this Italian study that found that half of the patients that had autoimmune hypothyroidism who followed a gluten-free diet actually recovered So basically reverse their hypothyroidism. To be honest, I always tried finding this study and I could never find it. But it's a study people talk about all the time. And I'm like, so the study I found, it didn't completely reverse it. It was more of, they also had celiac disease. So I'm not sure if that's the same study. People are kind of just, they play telephone and now it's kind of changed what people are saying. But apparently there is this Italian study. But this team right here actually had a case. So this is a case of, it was a 15-year-old girl and she had hypothyroidism. So they gave her T4, right, brought their TSH down. And then 3 months later, she actually got diagnosed with celiac disease. So she ended up going completely gluten-free. Then suddenly what happened is a few months later, I think maybe it was like 10 months later, 7 to 10 months later, she started getting symptoms of hyperthyroid. So sweating, that kind of stuff. And they noticed, they tested her and yeah, she was in fact hyperthyroid. So they reduced her medication, and they actually completely got rid of it. So she's one of those cases that, by avoiding gluten 100%, she ended up reversing her hypothyroidism. But she was diagnosed with celiac specifically. So not just a gluten sensitivity, a gluten allergy. And then this other team, they basically did a meta-analysis, and they found that it's true. People with celiac disease are more at risk of having a thyroid disorder as well. So these scientists, all these people are saying, okay, if you have celiac disease, go test your thyroid. But I'm kind of saying, okay, well, wait, if you have a thyroid issue, go get tested for celiac disease. Another question people ask me about is soy for the thyroid, because it is controversial, because to be honest, it's been shown to give benefits as well. So it's really hard to say. Soy doesn't seem to affect the thyroid hormone levels in research, but individuals who eat soy tend to need higher dosage of thyroid hormone. So it's kind of, okay, what is it, right? So definitely more research is needed to confirm if soy is a nay or a yay. So with my patients, I usually say, you know what? Well, to be honest, I put them on an anti-inflammatory diet. I'll talk to you guys about the diet anyways after, and there's no soy and no gluten in it anyways. But this team, they looked to see about soy and hypothyroidism, and they actually said that people that had hypothyroid and actually ate soy, it actually improved their cardiovascular health. So they showed that soy was actually beneficial for these people. So again, soy is kind of in the mix here. Here's my anti-inflammatory diet. So anybody who has seen me, especially for hormones, I probably put them on this diet. It's basically a diet where it's called the elimination diet as well. So you eliminate all foods known to cause inflammation in the body. So this includes healthy foods like there's no bananas, strawberries, melons, tomatoes, peppers, no eggs, so it's no soy. So you eliminate all those, but it's not a forever thing. It's just for 21 days. And then you introduce foods one at a time to see which ones you react to. It really just basically resets your body, I find. If you were told that you had a high HSCRP, so you have inflammation in you, I really recommend you do this diet. It's in the handout section, so I did give it to you guys, so you guys can download it if you want it. Food intolerances and hypothyroidism. So a lot of people with hypothyroidism end up with food intolerances. And usually this is secondary to low stomach acid. So basically, if you don't have the proper stomach acid, you're not going to break down the food properly. So bigger chunks of food are going to go in through your intestines, and they're going to damage the walls of your intestine, right? They're going to cause something called leaky gut. That leads to bigger pieces of food. It's still minuscule. I don't think you can see it with your eyes, but still big for our body, that ends up in their bloodstream. And then your immune system sees these pieces of food and they're like, oh no, red alert, you're not supposed to be here. And then you end up with food intolerances. How to find out about them? Again, if you do the elimination diet, you're getting rid of a lot of the food intolerances. So that's definitely a way to doing it. But some people want to get tested. They are expensive. They're usually over $400. There's the two ways that most people choose to do it. One of them is called IgG food intolerance testing, and that's a blood test that tests about 220 foods, or you can test them through the stool as well, and that's the IgA testing. So basically what I explain to people is that your immune system is made of a bunch of different soldiers, IgG, IgA, IgE, IgM, and any set of soldiers can react to a food. And you can basically have a food intolerances because of any type of soldier. So sometimes when you do the testing, you have to test the different soldiers to see, okay, which soldier hates which food. Now, something that's not talked about a lot is the microbiome and hypothyroidism. So, microbiome is basically all the good and the bad bacteria in our body, right? And we now know that the microbiome is really a source of a lot of diseases. So, if it's disrupted, it can cause a lot of disease states. So, I tried looking, is anybody studying microbiome and hypothyroidism? And they're really hard to find the studies. We do know that people with hypothyroid, though, they do have an altered microbiome usually, but we don't know which came first. Is it because they had hypothyroidism, which caused the low stomach acid, which means bugs were able to come in, which means that their good bacteria were reduced because the bad bacteria are there? So we're not sure, but it's definitely something to keep an eye out for. And I highly recommend that any thyroid patients should probably take a probiotic and a prebiotic. Prebiotic is food for the probiotic. Hashimoto's disease. So like I mentioned before, if you have Hashimoto's disease, you're going to want to do a few extra couple things. So people with Hashimoto's disease tend to have high anti-TPO, so the antibodies. They'll be positive in about 80 to 100% of patients. Although they're going to be about 10% of the population seems to be positive for this antibodies without any symptoms. They will often have more of a picture of subclinical hypothyroidism when it comes to TSH. So often, they're going to come in, these people, they're going to have all the side effects or the symptoms, of hypothyroidism. And then you look at TSH, it's good. Free T3, free T4 is good. Reverse T3 is good. And then you look at the antibodies and they're high. So again, the symptoms for thyroid usually show up before the lab results. So we have to listen to our patients. And if you are a patient, you need to be able to express yourself and find somebody who's going to listen to you. If you have Hashimoto's disease, you're going to always want to test your vitamin D levels because recent studies show that Hashimoto's patients have 50% less serum vitamin D than controls. So make sure your vitamin D levels, if you're in Ontario, are above 120. And then we already talked about celiac disease. So people with Hashimoto's are more at risk of having celiac disease. The standard Hashimoto's protocol, so usually we'll treat it with T4 and T3. That's what I recommend. Like I said, desiccated thyroid seems to work fine for a lot of people with Hashimoto's, so I'm not opposed to giving it. Selenium, 200 to 400 micrograms, or 3 to 4 Brazil nuts per day. Vitamin D levels are above 120. Test your urinary iodine, supplement if low. So that's the thing. People are like, oh, I have Hashimoto's, I took iodine and I got worse. Tested before, because if you have low iodine, even if you have Hashimoto's, you are going to feel better probably if you take more iodine. Make sure you balance your microbiome. That we know that the microbiome is huge when it comes to autoimmune diseases. So the more diverse your microbiome, the better results you'll have. Go gluten-free, probiotics, prebiotics. There is a test. You can actually test your microbiome. Now they offer genetic microbiome testing. They offer stool microbiome testing. They're quite expensive. The stool one is anyways. It tells you all the good and the bad bacteria you have in you though. So what's nice about that is that it tells you which probiotic would be a good choice for you. And then you'd want to do the anti-inflammatory diet, or there's something called the AIP diet that I'll often recommend for anybody with autoimmune disease. It's the autoimmune paleo diet. It's very similar to the anti-inflammatory diet, but you're not allowed grains at all. Hashimoto's patients will want omega-3s to help with inflammation in the body. And it's really highly recommended to do heavy metal testing and then to address that if it's necessary. I told you guys earlier that the adrenal glands are super connected with the thyroid. And if your adrenal glands are not functioning properly, it's going to affect your thyroid, right? So the adrenal glands are found on our kidneys. They secrete a lot of different types of hormones. The one that we're most interested in is cortisol, because that's the one that we know has a huge impact on thyroid. So it's released by the adrenal glands. It's responsible to help us deal with stress. So it's our fight or flight. So if somebody's super stressed, they're going to have high cortisol. When cortisol is too high, it causes heart palpitations, can cause weight loss, hair loss. Eventually, if cortisol is too high for too long, it'll just flunk and it'll get too low. That's when people get burnouts. They still have all the symptoms usually of high cortisol, so hair, weight, that kind of stuff, but then they have the extreme fatigue. When cortisol is too high, it prevents the conversion of T4 to T3. And then when it gets too low, it actually will affect TSH. It'll cause it to rise. So just like the adrenal glands, everything starts with the brain. So the big woman up there or the big guy up there, the hypothalamus, will tell a different part of our brain, the pituitary gland, to tell our adrenal glands, hey, let's go, you need to work. We call this the HPA axis, so hypothalamus pituitary adrenal gland axis. And I wish it was so easy that it was linear, but it's not. It's all over the place, and there's these chemicals acting on it from everywhere. The adrenal glands, they really have an impact on all our bodily systems. So whether it's our GI health, our immune system, and it's really interlinked with the hypothalamus pituitary thyroid axis. So it has a huge role and influence on the thyroid. Cortisol in the morning is supposed to be high when you get out of bed, so it gets you going, gets you out of bed, and then it goes down throughout the day. It helps us deal with stress. If you're on the birth control pill, it can increase cortisol levels. So I always encourage anybody on the birth control pill to test their cortisol level, because if it's really high, that's not a good thing. Increased levels of cortisol can lead to inflammation, heart palpitation, hair loss, weight issues, and it will inhibit your ability to activate T4, so to turn T4 into T3. Like I said, if cortisol is too low, fatigue, anxiety, poor stress tolerance, depression, people have brain fog, lack of focus. And cortisol can be tested in the blood or the saliva. So serum cortisol levels, usually I like to test it in the morning because that's when it's supposed to be at its highest. So I prefer levels above 300 in the morning. Salivary cortisol is better though, because you want to know how much of the hormones in the tissue. And with that, they can actually map it out. So you give 4 samples, you go home with a little kit, and then you spit in these little vials 4 times in a day. So morning, afternoon, evening, and before bed, and then they map it out for you. So cortisol, so this person, their cortisol is a bit low in the morning, right? So it's supposed to be higher in the morning, but at least it has that curve. And then the rest of the day, they seem okay. If you have high cortisol, there's natural stuff you can do. Magnesium, super important for adrenal health. I'll give my patients phosphatidylserine, GABA, L-theanine. If a woman's in perimenopause, menopause, or postmenopause, I'll give holy basil if they have cortisol issues. And then I highly, highly encourage anybody with any type of adrenal issue, whether they're working too high or too low, yoga is amazing. I see the results with my patients. They literally come in, their adrenal glands are super off, and then they come back to see me in 10 weeks because that's when I usually retest cortisol. They've done yoga. They haven't even taken anything for their adrenal glands. They literally just did yoga, and their cortisol levels look amazing. So you can boost cortisol with licorice, so glycyrrhiza, maca. So a lot of the herbs you have to be careful with, because if you're on medications, they might interact. So just keep that in mind. I prescribe desiccated adrenal extract. So just like desiccated thyroid, you can actually get desiccated adrenal extract. Usually that you have to get from a compounding pharmacy though. But for some people that the cortisol is too low, it does give them the boost that they need. And then quickly, before we go, just some quick frequently asked questions. So will I have to stay on the thyroid medication forever? The truth is that most people do. I have seen some cases where, they were hypothyroid as a kid and then they didn't need it later on in life. There's people that they end up on thyroid medication during pregnancy or after pregnancy, and it seems like when they stop breastfeeding, then I guess their hormones rebalance themselves and they can get off their thyroid. So those are the cases I've seen, and I've seen a couple of cases where their adrenal glands were so depleted, but as soon as we took care of their adrenal glands, they didn't need any thyroid anymore. So those are the 3 cases that I've seen. And I get asked all the time, how can I switch from T4 to desiccated thyroid? So when you see a practitioner, what I personally do is I match the dose. So whatever your T4 dose is, I have my little chart and I give accordingly the desiccated thyroid. Then I retested 4 weeks, TSH, free T3, free T4, and I adjust the dose accordingly. And that's what I do. And some people, right off the bat, they feel awful. Some people feel amazing. Some people feel hyper. So it's unpredictable, really. So I usually tell people you got to be patient at the beginning because it might take a good, 8 to 12 weeks to really find that perfect dose for you. If somebody has high TSH, but they also have high free T3, then I actually tell them they should be taking T4. So not everybody's a candidate for desiccated thyroid. Some people just naturally have high T3, but their TSH is high. So we know their brain thinks that the thyroid's not working well. So for those people, I say, you know what, you're going to have to give T4 a try. I always laugh at this. Dr. Rothenberg is a big thyroid practitioner in the States, and he talks about something called thyrophobia. Basically, it's a disease frequently seen in physicians. It's endemic in endocrinologists, and the symptoms include treat on a basis of lab tests, not clinical, prescribing only T4 and not enough, and chronically arguing with integrative colleagues. So, thyrophobia. I always thought that was super cute and funny. So in summary, if you suffer from hypothyroidism, assess your TSH. Is it below 3? Because that's what you want. Test your free T3, free T4. Check to see if it's your immune system attacking your thyroid. Check your iodine status, selenium status. Do you have a bromide cadmium toxicity? Make sure you're relaxing. Keep those adrenal glands um, uh, relaxed, right? Do a salivary adrenal function test if you suspect that your adrenal glands are off. They're a bit expensive though. They are over $200, I believe. And if you're not getting the results you want, or if you don't feel good, like you think you should, taking only T4, then consider either adding T3 or switching to desiccated thyroid. And that is it for me. And I think I went a bit over time, and I'm sure people want to go do their own thing. So we're going to look at questions. So some of these questions I've kind of answered in the presentation, so I'm going to go down the list and look for some that maybe I haven't. So somebody asked, is there any hope for me to safely stop taking the Synthroid medication that I've been on for 25 years? What are the dangers? I am now up to a certain dosage. What are the side effects of the medication as well, in particular concerning bone health, please? So as far as bone health, even with Synthroid or if you're taking levothyroxine, to be honest, I'm not worried about it. No. So unless you're super hyper, if you're getting signs of hyperthyroidism, fine, but you should be okay as far as bone health. And you can always do the test, the telepeptide test I was telling you about, to see if you want to know, and get bone scans done and see how it is. For most women, though, for menopause and postmenopause women, we're already at risk, those women, just because our estrogens are lowering, and estrogen is so important to prevent osteoporosis. As far as getting off Synthroid after 25 years, to be honest, it depends. I mean, what are your levels on Synthroid? Is it bringing you optimal? Because like I said, most people end up having to need the thyroid medication for long term. Graves' disease is hyperthyroidism. So that's when the autoimmune, the immune system is attacking the thyroid, but it's causing it to be hyper. To treat Graves' disease, there's products specifically for that. It just helps lower thyroid hormone. But remember that it is an autoimmune disease. So you'd want to do any basically autoimmune protocols. So doing an autoimmune paleo diet, that kinds of things, making sure you don't have inflammation in you. Would unregulated thyroid cause someone to have unbearable pain passing their stool and urine during their period? So it shouldn't. It's weird that you say that, because I have heard that sometimes from people with hypothyroidism, but it's really because all your hormones are linked, to be honest. So what you're describing, the pain while passing stools and urine during a period, usually it's because someone's estrogen is too high. So if I were you, I'd actually check my estrogen if you have those symptoms. So somebody wrote, so my husband has hypothyroidism, then has been found to have prediabetes and gout. Now, what's the link between all three? I think one of the link between all three is inflammation. I see diabetes as an inflammatory disease. So for me, the goal for your husband should probably be test his inflammation, see how that is, and go from there. Somebody said they have Hashimoto's. Recent numbers are within range. Their antibodies are really high though, and they have signs of hyperthyroid symptoms. So losing weight, insomnia, worry a lot. I would test here for environmental toxins. I would want to know what your bromide and cadmium levels. And you might even want to do more heavy metal testing too, environmental testing like fluoride levels, mercury levels, lead levels, and stuff like that to see is that kind of impairing with your situation. Somebody says they're taking Synthroid, Cytomel, they're taking estrogel, which is a bioidentical estradiol, and they're taking Prometrium. So that's a bioidentical progesterone. Is it a problem? I don't think at all. I think, for us that are super into anti-aging medicine, taking hormones is what prevents you from aging, really. So, but the point is you want to get tested. You want to make sure that if you're getting tested in your blood, if you're taking estrogel, usually I'll bring women's estradiol levels to 120, max 200. So make sure you're not going above 200. And Prometrium, progesterone helps us women stay calm, helps us deal with stress, helps us with sleep. So if you're taking bioidentical progesterone, again, you want to get tested. If you're doing it in the serum, most women, when it starts getting above 4 or 6, they're like, oh, I'm sleeping through the night. Usually a lot of women will be like at 12, oh, I feel amazing. And then 20 for me is the cutoff. So if you're taking hormones, whether it's thyroid, estrogen, progesterone, just get them tested. For the sex hormones like estrogen and progesterone, you're going to want to test something called estrone, which is your bad estrogen, right? Because sometimes even if you're taking the good hormones, your body can convert them into the bad. So you're going to want to check that for sure to make sure that your estrone is not too high. And you can also test those hormones in the saliva, which usually gives a better picture. Although they say that, okay, you test saliva, it tells you exactly how much hormone. But when I prescribe hormones, to be honest, the outcome just always ends up being the same because I go by how a woman feels as well. So. Someone asked if I also do counseling as a dietitian. So as a naturopathic doctor, we are really, really knowledgeable in nutrition. I mean, it's part of our entire program. We do have amazing nutritionists here. So the thing that I love about working at NutriChem is that I work with pharmacists and nutritionists, and we have meetings once a month, all of us, and we talk about all our cases and the complicated cases. So I don't just do nutrition usually. But our nutritionists are amazing. So I would definitely, if you're considering seeing somebody, I would definitely recommend the NutriChem nutritionist because honestly, they know just as much as me. And if they don't know, they're going to talk to us naturopaths and us pharmacists, and they'll find out for you whatever they need to know. Yeah, somebody asked, can I explain the connection between low thyroid and miscarriages in the first trimester? So why that is, we're not 100% sure, right? I do, like I said, all the hormones, they're all friends. They all chat together and stuff like that. But we do know that if a TSH over 3.0 for some women can hamper them from getting pregnant and can increase their chances of a miscarriage in the first trimester. But to be honest, the mechanism behind it, I'm not sure. Somebody asked if they can have a copy of the presentation. So there will be a recording. So it gets automatically sent out in 24 hours. So you're going to get an email with the recording. As far as the presentation slides, they're under the handout section in your little menu. Somebody just started Eltroxin, so they just started taking T4 because they were diagnosed with hypothyroidism, and they're getting tested only in 3 months. I personally think that's too long to wait because if you suffer from hypothyroidism, it's not fun, honestly. And within 4 weeks, your test results will be accurate, so we'll be able to know if you should increase your dose or not. So yes, it can definitely be done sooner. Somebody asked if I work at NutriChem in Ottawa. Yeah, we have 2 locations in Ottawa, and I actually work at both. I'm actually the clinical director, so I actually run both clinics, and I work 2 days a week at each clinic. And that's it, everyone. So thank you so much for your questions. I hope we answered everything. If you have any questions, you can email us at info@nutrichem.com or events@nutrichem.com. And like I said, everybody's going to get a copy of the webinar recording within 24 hours. So I hope everybody enjoyed it. And there will be a little survey when you exit the webinar. It's going to ask you for different topics because we have all our clinicians that do webinars. So if there's any topics on webinars you want to hear, just let us know, and then we'll definitely consider it. Thank you. Have a great night.